to be seen on camera for the recording. Okay. But either way. So Marshika, thank you for joining us again today and being our spokesperson as we look at our diagnostic test. Last week, when we looked at lab results, we'll start from there, that sometimes the results that we get from our labs lead us into some common diagnostic tests. So when your clinicians offer you new tests and suggest that you do additional testing after lab results come through, this is what we want to talk about today. And Marshika, who has had experience of over greater than 17 years in clinical operations, is going to guide us and lead us through this conversation today. Feel free to ask questions as we go along, and raise your hands, or if you've got something to add to the conversation, that's what it's all about. Enjoy. So thank you, everyone.
All right. Thank you so much, Lisa, for that great segue. And to your point, I just want to level set expectations. This is just an overview, of course. This is not meant to replace any specific instructions from your doctor. There's also, these are general diagnostic tests. And of course, depending on your age, your sex, or any some other factors, your additional testing may be different. So as always, we suggest you use this as a starting point for talking to your doctors and just lean on their instructions for these additional tests. So as Lisa said, we talked last time about routine lab tests and what those results can mean. So sometimes, as we said, some of the tests that we talked about, the blood test may show different things that will require further testing. Urine can require further testing. Of course, if you're experiencing specific physical symptoms such as shortness of breath or chest pains, they may prompt your doctor to do some additional tests such as an ECG. If you're experiencing unknown head symptoms such as a headache, dizziness, seizures, CAT scans or CT scans or MRIs are also can be looked at. And of course, if you have a family history of cancer, there are going to be some specific potential genetic testings that can assess your risk. So we're just going to take some time because we've only got about 40 minutes together. So I'm just going to go over some of the higher level ones. Next slide, please. Next slide, Jeps, I'm sorry. All right. So, of course, for women, a mammogram is most important. And as I said, depending on your family history will determine when you will start having these done. But as we're talking here about all of these diagnostic testing or additional yearly testing, this is really important for us to kind of stay on top of these because we know early detection is best. So as we know, for mammograms for women, it detects breast cancer at an early age. Sometimes this can detect something before you can physically feel it. Those mammograms can be used to rule out cancer as well. So what is a mammogram? So basically it's, as anybody who's experienced it, your breasts are pressed between two plates and it allows for an image to be taken. We've probably heard of, as of late, 2D versus 3D mammography. And these are just two different kinds of imaging because they can give a better look at the breast tissue, right? This is also, there's some radiation exposure, but in general, it's not a high amount. And so this is definitely one of the safer, most sought after, and of course, accurate means of early detection. A lot of women, regardless of your age, we do have dense breast tissue. And if you talk to your doctor and they find from looking at your mammogram that you have dense breast tissue, there is standards expected where you will have additional screening to give them a better look at the breast tissue. Okay. Again, it depends on your doctor, some other factors, your age and family history. All right, next slide, please, Jobs. And of course, for the men, prostate tests are very important. As we talked about some of the lab tests that are available, there are blood tests that can be done, and depending on what those levels look like, that we talked about the last time, your doctor may ask for you to go to further testing. Digital rectal exam, which is a physical exam of the prostate, is done, or also MRI, which is another detection, which is external, can also be done to get images of the prostate. There's also a transrectal ultrasound, which is just another way of giving the doctor a closer look at the prostate to give it a better option, a better to see better if there's anything that they need to look further to. Depending on what the outcome of those are, then you may have to undergo a biopsy. And here I've mentioned some of those. And then from the biopsy, the Gleason score may be assigned, and it can determine if it's malignant, which is cancerous, or if it's benign, which is just the growth in the prostate. So again, depending on what your doctor sees, there may be options for further testing, and further testing as well, staging, as we're going to talk about with some of these other test results that can help better pinpoint how invasive or what kind of cancer it may be. So it's just, again, this is just the first step for some of the testing for prostate. Next slide, please. A CT scan, or also called a CAT scan, it is a diagnostic tool that uses X-rays and computer technology to provide a detailed image of the inside of the body. That can be used to diagnose infections, bone fractures, cancers, heart disease, strokes, or instances of internal bleeding. Of course, during this CAT scan, you will lie on a table, this big, humongous, as I have a picture here, donut shaped machine that rotates around the body, taking these X-ray images at all different angles. And then when the doctor gets the results, these many pieces are put back into one look. And that's what they actually look at for the results. Like we said, it does use light. It does have some radiation, which of course can cause cancer. But again, you can talk to your doctor about that if you have concerns about having a CT scan done, and if there's any alternative testing that might be a better fit for you. All right, next slide. MRIs, or magnetic resonance imaging, is also used to diagnose conditions such as, of course, injuries, diseases, abnormalities in your organs or tissues. It gives highly detailed images of these soft tissues, which are often difficult to see with other imaging techniques like X-rays. This is also non-invasive and does not use ionizing radiation, which some of these other tests do, and we'll talk about that as we get to them. But this can also be used to create 3D images. An MRI machine uses powerful magnets and radio waves to create these images. These can be used for diagnosing issues with the brain and nervous system, such as multiple sclerosis, can detect damage from a stroke. Of course, brain tumors, aneurysms can also be visualized with MRIs, dementia, epilepsy, spinal cord injuries. So all of those really brain and nervous systems, injuries can be seen with an MRI. For your internal organs, heart disease can be assessed with an MRI, as well as liver, kidney, some pelvic issues such as with the uterus, ovaries, or prostate, as I mentioned before. And of course, cancers, it can also be used to detect in certain parts of the body. It is very useful in viewing blood vessels. And so, of course, it's one of the best tools for diagnosing vascular abnormalities. Joint injury.
I was going to ask, has anybody on the line had an MRI for after a dense mammography was done? I've had to have that done, a baseline, especially family history. Have others on the line had those? And I don't want people to be surprised if they might be asked.
Yes, I have, Lisa.
Okay. All right. Thank you for that. MRI, as we were saying, the musculoskeletal, cartilage damage, other joint injuries, osteomyelitis, which is an infection of the bones. So, of course, soft tissue. So many different disease states can be visualized with the MRI. And again, it is non-invasive and does have a small amount of radiation. All right. Next slide, please, Jabs. So an ECG, which is an electrocardiogram, is another non-invasive test that records the electrical signals produced by your heart. So here in the picture here, you can see the fella's laying on the table. He's got electrodes attached to his body, and then the ECG machine translates these signals into a tracing or a graph that shows the rhythms of their heart at different parts of the heart pumping. So it's very useful in looking at things such as arrhythmias. It can tell if a person's had a heart attack, if you've got coronary heart disease, which is narrowing of the arteries that supplies blood to the heart, which can happen sometimes maybe high cholesterol or different reasons for that. Cardiomyopathy, which is a disease of the heart muscle. They can use ECG to also, sometimes it may be used pre-operative so that the doctor can assess how a certain drugs might affect, or if you've got a pacemaker, is it working? So ECG can be used for just non-invasive testing of the heart in many different ways. And one thing to note, this particular picture is showing the patient laying on the table, but usually the 3 different types will be a resting ECG while you're laying down. I've had one actually done an exercise ECG where I had to just jump off the table like you see him here and get on the treadmill for a couple minutes and then lay back down for them to take the ECG. There's also a portable one that sometimes you might have been sent home with, just if your doctor wants to monitor your ECG for, let's say, 24 hours or more. So it's a little backpack, I believe, small, pretty small, and you carry that around with you. So it's monitoring your heart for those 24 hours or so. Okay. Next up, we have our PET scan, which is a positron emission topography scan. This is another imaging technique, non-invasive. And it's a little bit different because in this one, you will have a radioactive substance, also called a tracer, injected into your bloodstream. And this tracer will accumulate in certain areas of the body that have higher metabolic activity. This helps to, and then when you get in the PET machine, which you'll see here on the picture, then it's scanned, you're scanned. And again, the computer takes a bunch of images and puts them back together to make a 3D image. And that really shows the doctor where those radioactive tracers are congregating. That helps also identify cancer cells, other tissues that may have different metabolic rates because of some abnormality, and just to help the doctor pinpoint any further looking. I would like to point out that PET scans are frequently combined with CT scans. So you'll see, especially PET CT, they're combined together, and this allows for the doctor to look at both anatomical structure as well as soft tissues and function of the organ. So you get a multifaceted look at the systems when you do it combined.
I have a question.
Sure.
Okay, so I'm looking at, it says it accumulates in the area of the body. So when they inject it, are they injecting it for a specific area, or it goes throughout the total body, and then they can identify where the problems may be like that?
The whole body, from my
Okay.
from my understanding.
Okay.
Well, yeah. And then, so we said PET scans can also be used to identify areas, like say in the heart, where there's blood flow issues, to your point, and that may be showing damaged blood tissue, right? Because if it's dead tissue, then it'll be more obvious for them to see it with the PET scan. All right. And they are also used to diagnose, as we said, brain disorders as well, such as Alzheimer's, epilepsy, and of course, brain tumors. And again, there's some people, and this is where you will talk to your doctor in detail again about the risk for your particular situation and which test he might order over some others. All right. And I'm kind of going back and forth here, but the electroencephalogram is an EEG. Earlier, we talked about an ECG. The ECG really looks at the heart. The electroencephalogram, which is an EEG, right? It looks at activity in your brain. And I have a picture on the next slide that'll show kind of how that looks, but it's the same concept as the ECG, and there's electrodes that are placed. One thing I've actually experienced this. My 13-year-old daughter had a seizure and we didn't know why. There was no reason. And her doctor, after doing CAT scans and all those other MRIs, sent her for an EEG. And in that, they can visualize your brain at different times. So in the case of seizures, EEG is a great opportunity for the doctor to look at the wave patterns in your brain and how they may change. It is also used for people as far as sleep studies, so they have sleep issues, brain tumors. It can assess brain damage due to head injuries. Encephalopathy, which is the general term for any brain dysfunction, right? So it can measure the different areas of the brain, and looking at the activity can determine if there's an issue specifically in certain parts of the brain. Stroke, of course, is also used to assess function after the brain function after a stroke. Also, it can be used to assess brain death. So if a person is considered brain dead, this is one of the tests that they'll use to assess that. As I said, this is a painless test, and it is non-invasive. The electrodes only record electrical activity, so it's not like it's going to deliver a shock to your brain. And then in some cases, they will use a strobe light, a flashing light, to try to elicit this response in your brain so that they can see it on the EEG. Okay. And as we said, there is different types of EEG, a routine one, maybe, and then prolonged EEGs, as well as ambulatory EEGs, which is like we said with the ECG that you can take it home with you to measure over the course of several days.
The tracer that's injected in your body, if it's radioactive, so is it something that gradually dissipates in your body, or what happens? And
it's not a tracer with the EEG. So you mean the PET
yeah,
scan?
I'm looking at the PET video. You still have that one up, and so that's what I was looking at that.
Oh my gosh, I'm sorry. So yeah, it's a very small amount.
Okay.
And again, your doctor can give you more details as far as what we call the half-life of the tracer, meaning that radioactivity only lasts a specific amount of time, right? Okay. So they give it to you, and they know after, when it comes to chemicals or drugs, we look at it in half-lives, which is how long it takes the body to metabolize it or excrete it, or how long does it take? Is it still radioactive? That's what's taken into consideration when they're giving it to you. So it's not, it's a finite period of time.
Okay.
Yeah.
Okay. Thank you.
And I'm so sorry. I'm sorry. I'm looking at this on my larger screen because I do have glasses on, but I still have trouble seeing it. So I'm a little bit ahead of Jap. So I apologize if
okay.
ahead. Sorry about that. And so we just went over the EEG, as I said, and which is really to look at the brain. So the ECG looks at your heart. The EEG looks at the brain. Okay.
Okay.
All right. So next up, we have an endoscopy. So an endoscopy it's used to diagnose certain things, or it can also be used in conjunction with other procedures, mostly biopsies, right? So you can have an endoscopy, and what it is a flexible tube with a light and a camera that's attached to it, that's put down your throat, down your esophagus, and they can look into your stomach, or sometimes it maybe it's part of your bowel, depends, but they can see it real time with that flexible tube. Now, in doing that, the doctor might just want to look just to see if you have any issues, or they may use that as an opportunity to get tissue samples, which we'll talk about with a biopsy. So your endoscopy, it can be used to just look at your anatomy, or it can be used as a supportive tool to help get the biopsy for further testing, right? This endoscope, which is, like I said, the flexible tube with the light on the end and a camera, it can be inserted through your body opening. So this one is it is invasive because it has to go in the body. It can go either through your mouth, through the anus, or the urethra. Sometimes there may be small incisions made to insert the endoscope, but again, this is really depending on what the doctor's intent for this information. And as I noted, we're going to go into more details, but it can be used for colonoscopy, gastroscopy, or bronchoscopy. So either look at your colon, your stomach, or your lungs.
I'm sure it's under anesthesia, right?
Yes, it's usually done under anesthesia. How much anesthesia? Again, that's up to your doctor and maybe their local practices, but it can be done. I've always had it done. I'm totally knocked out.
Mm-hmm.
So propofol is a good thing when it's used correctly. And I've actually, to be fair, have had an endoscopy and a colonoscopy at the same time. Because of the timing, and the doctor suggested that. So again, talk to your doctor and look at the full picture, because as we've noted here, some of these procedures can actually be combined, and so they can get a full picture by combining them. Okay. So that biopsy, as I said, we can go to the next one. Yes, thank you, Jabs. The biopsy, so this can be done in different ways. So we're going to spend a little bit of time here because this biopsy, I think, is used for many, many different diagnoses, standard, or of course, in response to some particular issues. It is a common diagnostic tool. It is invasive because they have to go inside your body to get the sample. It depends on where the sample is coming from, will determine how they prepare the area, or as we talked about, what kind, if you have a local anesthetic, or if you might have to have a bit more than that. You may be completely out, like we talked about with the endoscopy. It just depends. Then once they get that tissue sample, then it's processed in a lab, especially I hope nobody on here really has had to deal with a cancer scare, but typically when you get that biopsy, you'll hear a tumor block, right? So they'll take a sample of that tumor and then they treat it and preserve it in what we call fixing the tissue. And you see this picture here, and they'll take it and in the lab slices it in very thin slices. And then they treat it so that the different types of proteins and tissues or cells that are here, they're stained a different color. So that helps them contrast it so they can see the cells. And then the doctor can then look at those cells and tell if they're abnormal or if they're normal and as expected, right? So, and when getting those particular tissues, right, you'll have an incisional biopsy, which is just a small piece of the tissue is just removed. Excisional, whereas if you've heard a woman going through breast cancer, she's had a lumpectomy, that's more like an excisional biopsy where they remove the whole mass. And a bit of, you've heard probably margin. So it's the cleaner tissue around that particular mass. They'll remove that and then treat it and fix the tissue and then look at it on the microscope. A needle biopsy. A lot of times that's easier to get to than fully, it's less invasive, but nonetheless, it's more about getting fluids in some tissue with a needle, right? And as we mentioned earlier with the endoscopy, an endoscopic biopsy is when that flexible tube is put down into the body. And from there, the doctor can go in that tube and also get some tissue in that way. Skin biopsy, of course, with skin cancer, of course, that's on the skin, and they would just remove that small piece of skin to look at. That can also be diagnosed, not just cancer, but melanoma or psoriasis can be diagnosed with a skin biopsy. All right. Next slide, please. And of course, always talk in detail with your doctor if you have any questions. But after the biopsy, depending on what type it was, you may have some bruising or some discomfort. Of course, if you've had to be put under for the procedure, you'll of course need someone to give you a ride home because you're going to still be groggy. And then, as I said, some other risks depending on the type. You may have some bleeding, a potential infection, pain, scarring, or damage to surrounding tissues. But again, this is a very valuable diagnostic tool for many different indications. And so if you have any questions or concerns, talk with your doctor. All right. Next slide. Colonoscopy. Again, it's done with the tube. As I said, as we always tell you, just, talk to your doctor about the prep for that. I think we're all kind of aware of what the prep is for a colonoscopy. And So you have to clean out the colon, which is the the part of our intestines that they're going to look at on the colonoscopy, right? And so you want to make sure that's clean so that they can also see the tissue and actually see if there's anything that they need to look at and get a good look at the tissue, the organ itself. As we said, of course, you'll have to clean out during the procedure. You're probably under anesthesia, so you're not aware of what's going on. They insert the the scope in the anus, and it looks to look at your colon, right? And surrounding tissues. It's used to examine the inside of the colon, which is your large intestine, the rectum, for any abnormalities such as hemorrhoids or polyps, any inflammation, or if there's cancer that is present, they can take a sample and send that off for testing to determine what it is if there is an issue. All right.
Question.
Sure.
So they, doctors always tell you an age they want to start doing a colonoscopy, or every 10 years. So is there an age that you stop doing it?
That is a great question. And I actually had my 84-year-old aunt, she had her colonoscopy done in February of last year, but unfortunately she passed away in January from biliary cancer. So yes, she was still diligent about the colonoscopy, still getting it done. Of course, again, it depends on your risk. It depends on your family history, right? Those kinds of things. But I would say this is considered, I think, standard of care. And so you really work with your doctor, and for you can decide how often you want to get it done. But I think we would all agree that at least that first one, you want to kind of stick to it, and, just to make sure. And like I said, if you have a family history, or when they get in there, if they see something, I've talked about polyps on the other slide, then of course you may have a different schedule, but you can talk about that with your doctor.
Okay, thank you.
I have kind of a funny story. When I had my colonoscopy a couple of years ago, the doctor I went to, when he was, giving you after it's done and they're telling you, what they saw, he told me, he looked at my age, and at that time, I guess I was about 70, 71. He said, oh, you won't ever have to do this again.
Oh, okay.
My goodness.
And I kind of looked at him sideways, and I said, oh, I'll be back. So when I talked to my primary care doctor, he said, yeah, you'll probably get another one before it's all over with.
You don't look, that's right. Because I don't believe your age, but you're right. You'll probably get another one.
So I was going to make a comment. Talk to your doctor, and your doctor may say one or two things, but the American Cancer Society does have recommendations of, say, 75 years of age that you might stop. But that's all, like Marshika said, dependent upon your history and what that means. And also, if you're healthy like you, Janice, the idea is, if you're going to live 10 more years, you're probably still going to be under screening for multiple things. And you're going to continue to do that. Another time you stop, when do you stop? I had my first colonoscopy and my first scare with a bad actor polyp. So my son has to have his first colonoscopy at 30. So there are ways, to look at things forward and backward. So I just wanted to share that little bit.
Definitely agree. And I did mention on this next slide, I purposely didn't want to get too much into ages, because it's so many variabilities, right? Yeah. But if we go to the next slide, and I did use this picture probably twice, and I shouldn't have, but this maybe we'll remember it. So Japs, can we go to the next one? Okay, great. So as we just were mentioning, it's different depending on your history, but it is one of the best tools for colorectal cancer screening. I think we can also, we can acknowledge that in our communities, this is one of the still killing us a lot, be it environmental factors or whatever. But this is definitely something that, if caught early, is very treatable, right? in mentioning here, as I said, the polyps, and as Lisa, as you mentioned, if there's an instance where you've had polyps, one of my sisters, she's had a polyp removed, and she did it, you know, they removed it, it was not cancerous, and then they just gave her like 5 years later, they said, come back, and they did it again, and now she's fine back to 10 years, right? So it just depends on your family history. But again, talk to your doctor, assess the risk, and the timing you can talk to them about as well. All right. And then the next up, we'll talk about the ultrasound. The ultrasound. I've had a couple babies, have had ultrasounds, but one thing I will allude to is sometimes with the mammograms, depending on if you have dense breast tissue, this is also done to help better visualize the breast. So it's not just babies, it's different indications that this can be used for, just to better visualize the internal parts of the body. It is not invasive. There's not any any major emissions of radiation or something, but because it's using sound waves, high frequency sound waves to visualize the body. I will also say that sometimes ultrasounds can be used in conjunction with some of these other procedures that we might have talked about to help guide the doctor on their other procedures. I've had an ultrasound with breast biopsy, because it helped the doctor guide her to where she wanted to take that sample from. So there's many different ways. So for women as well as men, as we talked about earlier with the prostate, sometimes these ultrasounds are used to help guide them as they're treating you for those. And it is non-invasive, and it does not have any incisions or radiation. And also it can show real time these images, and the technician, as you see here in the picture, they take all these pictures, and then the doctor looks at them and makes an assumption from there. So pregnancy, as we said, organs can be imaged. So gallbladder, your heart, your kidneys, your liver. I had my gallbladder removed, and I was amazed to look on that ultrasound, and I could see all the gallstones quite clearly with my untrained eye. And also it checks for blood flows in your arteries and veins. So very safe and effective way to visualize your internal body structures. All right. Next slide, please, Japs. Hearing test. To be honest, when I was putting this together, I thought about it, and I don't remember the last time I've had a hearing test. But it can still definitely be a standard part of your ongoing care. It can be done if you're starting to have trouble with hearing or concerns about it. Of course, if children, they are tested first if there's at birth, and if they're having some developmental delays or some difficulties in communication, then this is one of the first tests that doctors may do to rule that out. These can be used to develop a treatment plan. Maybe you need a hearing aid or implants or any other intervention. And here I've listed 6 different common diagnostic hearing tests. Again, you'll talk to your doctors to decide which one is best for your particular situation. But I'm pretty sure the top one here is the one that we've probably all, the audiometry is the one that we've probably had the most.
And the best thing to do is, if someone in your family says you need a hearing test, don't brush them off.
Yeah.
Don't brush them off. Just say thank you and consider going to have a hearing test.
Yeah. Yeah.
I laugh, but it's so true.
Yeah.
Yeah.
And as we age, of course, our hearing goes, so this definitely should be, one of our ongoing tests. And some of these others are way more involved, but it looks at the structure of the ear fluid or your eardrum. Like if you've had a busted eardrum from something, a loud, sudden noise, a firecracker, a gun, or stuff like that can bust your eardrums. Autoacoustic emissions. Again, that's another way that newborns are screened because they can't necessarily raise their hand and say, to motion which ear they're hearing the sound. And so that's a way to test someone who's not able to do that. And then the brainstem as well, the auditory brainstem response. And that's also measuring nerves and brainstem in response to sound. Can be used in infants and as well as others to diagnose neurological disorders. Speech audiometry. Again, that can be done to assess how you're hearing and understanding different words in different environments. So another piece, because some people, when they're in a room with background noise or a bunch of different people talking, it's harder for them to hear. And there are tools to help them hear better in those kind of situations. So this is just one test to help to see if that's where you're struggling, and they can help give you something to help clear out that noise. Tuning fork test. I must say I have never had that done either, but that's another option, and we can all think what a tuning fork is, and it can be used to measure your hearing.
Mm-hmm. I've had it.
Have you really?
And they ping it, let you listen, and tell you when you stop hearing it.
Oh, okay. All
And
right,
then they
and
do it also for vibration in the bones, in your stapes and the inner ear bones and stuff. Yeah. So.
Okay. Next slide, please.
I have a question. I don't know if you're gonna, okay, yeah, let me ask the question. Does hearing loss cause other problems?
That's a very good question. That's a very good question. I'm going to jot that down, and we're going to look into that for you.
The reason I ask is I have heard or read or somewhere along the line said that if you have a hearing loss, you want to get it checked because it could be a connection or lead to cause some mental Alzheimer's, dementia type issues.
Yes. So definitely hearing issues can be a foretell into some other issues, but I wrote down the hearing loss doesn't cause those issues, but it may be a symptom of some of those indications, I think is what your question was, such as you used the example of Alzheimer's.
Yeah, like if you have a hearing problem and you don't get a hearing aid, I mean, obviously if you can't hear horns and things like that, it can cause, not stopping or whatever, but
Yeah.
Is there any relationship? Does it actually lead to or may hurry up something with dementia? I don't know.
We'll look into that. I think that's a very good question. That's a very good question. We'll look into that. But to your point, the opposite, I think, is more we've probably more used to that hearing loss or the lack of hearing is a symptom, and that's one of the first things that you notice, right? So I think I have grandparents that had Alzheimer's. And in some cases, yes, we would be talking to her and she didn't respond. And sometimes it is because she couldn't hear, and then other times it's just she just wasn't paying attention to us, right? So I think it can be a symptom, right, that can lead you to look at others. But I think to your point, doing that test can rule that out and give them that extra bit of support. Like if they truly are not answering you because they can't hear you, then we fix that, and then it doesn't make it seem like they're so out of sorts. So that's a very good question. Thank you for raising that. And as I sit here with my glasses on that I probably sleep in most days, of course, we have to have eye tests. And this is important for so many different reasons, because looking in the eye can really signal different issues, right? Not just our nearsightedness, or like myself, I have astigmatism as well. It can be used to pinpoint some other issues in the body. It's diagnostic, and sometimes you can find things before the symptoms actually appear. I have my husband's family, his mother has high pressure in her eyes, right? So knowing that my now 24-year-old son, he's aware that he tends to have higher pressure in his eyes, right? And what does that mean? It could be different things, but just being aware of that, and that's your normal, right? Because here I talk about some of the parts of the test that they do. So the tonometry measures the pressure in your eye, right? They look at that. When the doctor shines the eye across, as you see here in the picture, she's got her face on that on the chin rest, and the doctor scans your eye, they can look in the back of your eye and visualize the veins and everything in the back of your eye, and they can better see the health of your eye, right? Then of course we'll have your exam where they're gradually changing, what you're seeing, and then measuring what you can see and what you can't, right? Electroretinography, ERG, that specifically measures the retina and in your eye. Corneas. We've had people, you probably heard, they've had corneal transplants, right? That can be done if there's a issue with your cornea and replacing it. So again, all this testing helps you really understand the health of your eye and if there's further testing that needs to be done. Okay. And next slide, please. X-rays. So as we talked about, we've all had an X-ray for one thing or another. It does use some radiation, but it's not a lot of radiation. You can talk to your doctor if you have concerns, but an X-ray is really a great way to visualize the inside of the body. And when that radiation passes through the body, depending on the type of tissue, be it the bone or soft tissue, it absorbs the radiation in different ways. And then when the radio X-ray is developed, you can see the contrast between the muscles and organs and the different density of tissue. And so that's what the doctors use to visualize those structures. Oh, thought someone had a question. So of course, you can see if you have a fracture. That was one of the easiest ways for them to tell if you've had a fracture. Chest X-rays, a lot of things are very diagnosable with those, like pneumonia, right? And of course, dental X-rays. We've all probably had that full panoramic X-ray every so often. That helps the dentist visualize your jaws and your teeth. Mammograms. Again, there's a specific type of X-ray used to screen for breast cancer, and we talked about that on the mammogram part. And of course, if there is something in the body that should not be, such as a child may have swallowed a toy, this also X-rays is a really non-invasive way to visualize that. So again, if you have concerns about the exposure and want to talk about that with your doctor, and again, work with your doctor to determine the best course for your diagnostic testing. And that's my last slide.
Thank you, Marshika. I
Thank
know
you.
that there may be additional questions, ask them, and I've got a couple of comments, but please ask your questions. I was going to make a comment about eye health. Oh, who is that? Go ahead.
Claiborne Watkins.
Hey, Clay.
Hi.
Hi. When you were talking about hearing loss and hearing exam, does ringing or buzzing in your ears, would that have a long-term effect on a negative effect on your hearing over the long term?
That is tinnitus.
Yes.
Yeah. And you know what? That's a good question. Let me take that down. And I will, if there's not somebody on here that can answer readily, I don't want to misspeak, but yes, you're referring to tinnitus. It can have different causes, but as far as causing ongoing hearing loss, that I'm not really sure, and we can check that out, and I'll pop a little comment in here about that.
Thank you.
Absolutely.
I have a question. This is Evelyn.
Mm-hmm.
Are you familiar with the beta knife and how effective that is in treating an illness?
I am not familiar with that. Is anyone else on the call familiar with the beta knife?
Gamma knife, beta knife, those types of surgeries?
Yeah, I've heard of it as a surgery, a gamma knife approach.
Okay.
And as far as the approach, it's more, it gives them an opportunity to be more focused on the area that they're going for. And that's like the benefit to taking that approach instead of being a more invasive and open procedure happening. And that's the extent of my knowledge.
Yeah, and I think that was a kind of what you just touched on. The first thing that came to my mind as well was for prostate. Typically, there's very specialized robots that do that surgery to decrease the injury, and it's very targeted. It's very exact. So I will definitely look into that beta knife. But thank you for bringing that up, and look for that as well. We can maybe pop something in, pull something together about that.
If you've heard
Thank
it
you.
from your physician or you've heard it from somebody else as a beta knife, what I'm more familiar with is related to the thyroid, thyroidectomies, you know, radioactive, some kind of iodine, something ablation. But that would be the most I could share with you, Evelyn, at this time. But to ask a clinician about it or whatever reference it might have been, it could be other ways too that it's associated, but not to mine. That's the only beta knife I'm more familiar with.
Okay.
Okay, but that there are a lot of things we won't know or know. We always need context, right?
I agree.
And I did want to say for eye health, as we talk about our communities and we need to get our eyes checked regularly, we have a greater incidence of glaucoma, cataracts, and diabetic retinopathy. So those things are important to us for our eye health, to ensure that we do that, eating well, doing what we can. Those who have diabetes can probably speak to us about their vision if their sugar goes up or stays up for too long or something like that. So those are things for us to be aware of and considerate.
And your prescription changing, right? Sometimes,
Yeah.
like I just said, I've known people that they can tell when their blood sugar is out of whack because their glass, you know, they can't, their glasses don't work, right? And so they're constantly changing them. And then when they realize that their blood sugar wasn't quite being regulated well, the doctor was able to stabilize them, and that kind of helped with some of that, those eyesight issues. So that's a very good point. Thank you for bringing that up. So again, we've taken some time to go through, if you know, the lab results that we did last time and what they mean and what they could maybe lead to additional testing. This is not an exhaustive list, but just some things, some common ones, and just to kind of try to explain them in layman's terms, so you've got something to go in and ask questions with your doctor. Of course, you should talk with them closely and let them help guide you on what's best for your medical history and your current health.
I was going to ask Mark, who put in the chat the SAT. So if you want to bring it up as something that should have been mentioned, go right ahead.
It was absolutely a joke. I felt like Marshika was so
I was like,
inclusive
huh?
of
I didn't
every-
get the
every
joke. I'm like,
Yeah,
doctor.
he was messing. He was messing.
Mark, you said I thought we were cool.
I was like, she did such a good job. I'm like, what test is that? I don't know what that is. Oh, that is great.
I love the work, Marshika. Fantastic
Funny.
presentation, great deal of detail in there. And I was like, good gosh, I think she got every test except the SAT or the Kool-Aid and hot
I
chocolate
got
test.
you. That is great.
Pardon my interruption. I'm stepping back out as I
We
promised.
tried to cover the rooter to the tutor, as we say. So I think we covered it.
We did. That was great. We've given it. Marshika has covered for us in these two sessions what we need to begin to feel comfortable with in terms of our lab work and other diagnostic tests. So we have at least a good baseline from these two discussions of what they're being used for. So what I want you to walk away with from this time is that diagnostic tests can simply be used to help understand somebody who walks into an office and has some symptoms. Or it can be used if you don't have symptoms and they use it so that they can screen. And if you have something, a diagnostic test can be used to monitor.
Yep.
so that you can have some of these same tests to continue to monitor the things that you want. And also it can tell you if things are progressing or how things are. So those are important ways to think of it. These are not just one and done tests. So they are good and valuable at different times. We didn't talk about this, but she gave you the right landscape for an MRI, a PET, and a CT. And I say that to you because insurance companies may tell you you can't get a CT, you can't get a PET, you can't get an MRI. And sometimes understanding, and maybe that's something we can look at for cancer, for other diagnoses and for other things, but when you want to use a CT first, and then when the MRI will come last, or when the PET will be where it is. But understanding that is another important part of how those tools are used, procedures and diagnostic tools are used. That's all I think we have today, except for other questions. Next, you're going to like this one. Next month, what do your feet tell you about your physical health?
Yes.
So I've got a couple of podiatrist friends that I'm speaking with about coming on board to speak with us. But if you have a recommendation or somebody you really want us to hear from, shoot me a text or respond to one of the emails. But that's going to be a good one. And if you wear the same pair of shoes 2 days in a row, you're not doing the right thing. That's the first thing. You should not wear the same pair of shoes 2 days in a row. Yes. So that's my little tidbit for now.
Thank you, Lisa.
Come back.
Hey, Lisa.
Yes.
Thank you for saying that, because now I can go buy some more shoes.
That's right.
Ladies and gentlemen, that was not my release for any of you to go buy more shoes, okay?
My husband left the room,
in the
but
home.
I'll let him know.
I recorded that. I'm going to share that. Yeah.
So if somebody's shoe bill goes up this month, don't blame me.
For my health.
It's for your health.
I thought it meant that you only need 2 pair of shoes. You just alternate every day.
Absolutely not.
No.
Thank you.
No. You know, there's some people who will wear the same pair of tennis shoes 2 or 3 times, you know.
Or
Not good for those different. Got the support. A podiatrist told me that, so that's great. So, I love that. Invite a friend, let others know. Yeah. Thank you for joining tonight. It is recorded. You'll get the links to the information where the slides came from and where we built this from, so that you will have it, and please share. So everyone have a great evening.
Thank you all.
Thank you.
Good night.
Thank you.
All right.
Good night.
Good night.
Thank you.